So somebody wrote in about EPI, which is exogenous pancreatic insufficiency, which means basically your pancreas doesn't produce the exogenous enzymes, which are digestive enzymes, lipase, protease, are the main ones. So EPI can be caused by many different things. You also said you tested negative for SIBO, so that's not a factor. It can be caused by hypochlorhydria, where you're not making enough stomach acid to get the whole cascade going. It can also be a result of a history of chronic pancreatitis, because basically your pancreas doesn't, work as optimally as it used to. So treatment is generally PERT, pancreatic enzyme replacement therapy. So they give you enzymes and things like Creon. To cure EPI, we don't really know if there's a cure. The treatment is the replacement of the pancreatic enzyme. And then, of course, if there's anything triggering some chronic pancreatitis, we try to address that. So that is the basic thing. And the way they test is they look at your pancreatic elastase levels and see if they're within a good range. So, and that's a simple stool test. So anyway, I hope that's helpful. Generally, we do use the pancreatic enzyme replacement therapies, and we try to reduce any triggers for chronic pancreatitis. And if there's other digestive symptoms as well, we try to address those. So I hope that's helpful. I'm really not sure why they prescribed rifaximin if you tested negative for SIBO. Just prescribing antibiotics on a whim doesn't seem to be a very good idea. So I'm not sure what the thinking was there. I'm not your doctor. But generally speaking, the antibiotics aren't that great of a treatment for SIBO. But if you tested negative for SIBO, I'm not sure why they did that, unless they think it was a flatline curve and maybe it was hydrogen sulfide. I can't get in the head of your clinician. And this knee-jerk prescribing of antibiotics when they aren't the most effective treatment for SIBO and IBS doesn't seem to work. For the bloating, it could be because you don't have enough pancreatic enzyme, or it could be that there is a microbiome issue, but it's not SIBO. Maybe it's lower down in the large intestine, like LIBO. So I'm not really sure why they did that. And generally not really happy with the treatment of just giving antibiotics out for, well, let's see what happens. It's generally not a very smart idea. So anyway, there are better treatments for bloating and motility issues that don't involve antibiotics. So I hope this is useful information.